I'm Joe Halco, Director of Community Relations for Northwestern Counseling and Support Services, and welcome to another episode of NCSS Here for You. Since 1958, Northwestern Counseling and Support Services has been providing access to high-quality service which promote healthy living and emotional well-being to the residents of Franklin and Grand Isle counties. Over the years, as the needs of the community have changed, so too have the programs and services that we make available to assist children, adolescents, adults, families, and seniors. We take our role in the community seriously and strive to provide a continuum of the highest quality services to meet the needs of individuals who at any point seek assistance. Did you know that NCSS offers transcranial magnetic stimulation, or TMS therapy? TMS is an alternative to drug therapy for individuals that suffer from severe major depressive disorder. To gain a greater understanding about transcranial magnetic stimulation therapy and its benefits, I am pleased to introduce this month's guests. They are Mathieu, Director of Nursing and Psychiatry, and Miranda Tatro, TMS Nurse Coordinator. I'd like to welcome both of you to the show this month.
Thank you.
So let's start with by discussing the partnership between NCSS and North Country Behavioral Medicine of Plattsburgh, New York.
Yeah, so a few years ago, we created a partnership between NCBM, which is North Country Behavioral Medicine out of Plattsburgh, New York, and NCSS, Northwestern Counseling and Support Services here in St. Albans. We did this to expand and increase access to mental health services in Vermont. So NCBM and NCSS work in tandem to provide transcranial magnetic stimulation services here in St. Albans. We are actively taking new patient referrals, and you don't have to be a patient of NCBM or NCSS, and you don't have to live in Franklin or Grand Isle counties to receive TMS services here at St. Albans.
I think that's an important differentiator between the norm of our, catchment area and what we do as an organization.
Exactly.
So let's go down the road of what is transcranial magnetic stimulation, which is known, a lot of people will use the acronym of TMS for it.
So transcranial magnetic stimulation is non-invasive. Patients typically don't have any systemic side effects. It's not medication-based, and it's outpatient. So patients come in and they don't have to have somebody drive them. And after their treatment, they can walk out without any potential ill effects. It is for individuals, as you said earlier, who suffer from severe major depressive disorder. That's the primary diagnosis that is needed for this medication to be covered, or not medication, treatment. So
speaking of treatment, what does the treatment entail and how does it work?
So TMS treatments are actually performed by our clinical TMS nursing staff, myself, April, and my covering nurses who are also nurses at TMS for our psychiatric services. Patients come in, they sit in a very comfortable chair. I joke with my patients, it's like the Cadillac. You recline. I've had patients fall asleep on me even. They're completely awake for the most part, with the exception of the ones that fall asleep on me, which is fine. And then for the duration of the treatment, it really becomes a safe space for them. They listen to music, kind of make it their own. Our staff specifically administers these treatments via a magnetic coil, and the coil itself is placed near the front left side of the head, which is known medically as the dorsolateral prefrontal cortex. So this is the area or the treatment zone, if you will. The coil itself stimulates the brain by sending magnetic pulses through the scalp to that targeted treatment area. The pulses generate small electrical charges, and what this does is it stimulates brain cells or neurons near that magnet, and the stimulation really activates neurotransmitters that we are trying to activate with antidepressants. So your serotonin, your norepinephrine, dopamine, these are all of the things that we're trying to stimulate with medications. And with TMS, we're using magnetic stimulation to do that. What this does is it releases those neurotransmitters, and it restarts or reactivates the area of the brain that is underactive in your major depressive disorder patients.
Okay, and how long are the treatments?
So individual treatments take approximately 30 minutes in office. Typically, we do treatments 4 days a week. And each patient has 30 regular sessions and then an additional 6 sessions of tapering down sessions. So it is a commitment, a few months of coming in 4 days a week for 30 minutes to do a full set of the TMS treatment.
And I would imagine that, there are individuals who, that sounds like a lot until you're somebody who's really struggling and you find that maybe this is the answer, and then it becomes like, what do we need to do here? I would imagine.
Yeah. And part of the therapeutic benefits of this is the coming in to our office for 30 minutes a day and sitting with the nurse and chatting and playing some music, doing some podcast or meditation. So each patient makes it their own of what they need during those sessions.
So even though it's an overall model, there still are these individualized ways to make it work that everybody's different.
Absolutely.
Very patient specific. Our patients, I joke with them, I tell them, by the end of this, it's going to feel like a breakup because they become part of their life. I'm with them 4 days a week most of the time until they start tapering, and I learn about their kids. I learn about their environmental stressors, and we talk about how to manage that.
So, question that some may ask, is TMS safe, and are there any side effects?
TMS has no systemic side effects. So what's typical of your medications to treat depression, your antidepressants, side effects typically are weight gain, sexual dysfunction, and that's specific to like drug therapy. That's the typical side effects that people see. ECT is electroconvulsive treatment, which when I first started doing this TMS treatment, every time I tried to explain it to people, they automatically went to ECT because of how it's represented in movies and what have you. And that's what's great about this show, is it's going to show that it is different. TMS doesn't require anesthesia or sedation, which ECT does. Like I said, patients come in, they have treatment, and they can drive a vehicle after. They don't have to coordinate for the treatment.
Sure.
And TMS is FDA approved and tolerated by most patients. There is a 6% dropout rate, which is very minimal overall. And that's usually due to intolerability, which is individualized from patient to patient.
Sure. Like with anything.
Right.
It's not going to be 100% for everybody.
Absolutely.
Depending on circumstances. Now, what would most patients say that the treatment itself feels like?
Actually, that's a funny question because most people say that it sounds and feels like a woodpecker that's tapping on their head. That's the most common explanation response of what they feel. Some patients report that they feel a slight scalp irritation, and others say that their eyebrow or their eye twitches a little bit during their sessions. That's pretty much the only thing that we're seeing.
And that's pretty typical. I also hear a lot of, it just feels like somebody's tapping. I've had patients tell me, oh my God, this feels like a brain massage, but it's not painful at all.
And like Miranda said, some people do actually fall asleep during the sessions.
Yeah. I've had a patient fall asleep on me on the very first treatment, and I was blown away because that really says something about how comfortable patients are when they come in to fall asleep in a room with somebody that you don't know with a treatment that you're not used to.
Absolutely. And again, you've mentioned the fact, no side effects or anything like that, that, if this is the answer for somebody who's had severe depression, this is fantastic. Just, terrific news. So does insurance cover the treatments?
Insurance absolutely covers the insurance. Actually, I have not had a single patient that's come through our program that does not have insurance approval. That's something that we're very adamant about trying to get patients covered. So most insurances, including New England Medicare and Vermont Medicaid, do cover this treatment as long as patients meet criteria.
Mm-hmm.
And the criteria specifically has recently changed so that there is easier approval, or more likely approval, should I say, for those patients, because the barriers have come down as far as those requirements.
Mm-hmm. What is it that caused the barriers to come down? Are you familiar with the
Yes.
reason?
So previously, the patients were required to do multiple med trials. In most cases, it was at least four medications that they have tried and failed. And now in the current depressive episode, which is really hard for patients to differentiate, because with severe depression, they've been living with this forever. But in the current depression episode, you need to have at least tried and failed one medication from two different drug classes. And that really goes by the mechanism of how the antidepressant affects the brain. So that's what they're looking for as far as differences in drug classes. Also, patients should have tried therapy and failed therapy. With that being said, some insurances don't require. It is definitely based on the insurance. For other treatment-related requirements, patients need to be between the ages of 18 to 70. And that's pretty much it as far as the requirements now. It was a lot harder to get people through before.
Mm-hmm. Well, that sounds good. I mean, anytime I think you can loosen up requirements so that the people that really need the service can access it.
Absolutely.
So speaking of that, do patients need to be referred for treatment?
No, patients don't need to have a referral. Patients can actually self-refer for TMS treatments. And if they have any questions about how to get into the program or questions about what the program entails, we'll have more information about how to contact us at the end of the show.
With that being said, we do request that any patient who is self-referring be followed by a primary care physician and a therapist or a psychiatrist, just because we do want to provide a continuity of care, as we do not change any medications. This is strictly TMS treatment at our office.
Mm-hmm. Now, speaking of patients again, is there any reason why a patient couldn't receive this TMS treatment?
Yes, there are a few things that do consider a patient to not be specifically a good individual for this treatment, and that includes individuals who have cochlear implants, cardiac pacemakers, metal plates, arterial stents,
or if they have tattoos with metallic ink or magnetic sensitive ink, or if someone has a seizure disorder, that could be a contraindication to having TMS services. But they can also check with us and we'll talk about that with them.
Or aneurysm clips, coils in the head, anything like that. Shunts typically. These are all reasons why TMS therapy would be contraindicated.
Sure.
Even jewelry in the head at the area of where we have it taken out. And it's because of the magnetic heating up that metal.
Yeah, no, totally understand that. Yeah.
Any patient that is concerned, though, they can absolutely call and we can run through, maybe they had dental implants, for instance. I actually just had this happen this morning, and I told the patient, well, let's figure out from your dentist who the manufacturer is, what the metal is, and we can see if it's compatible. So just because you're thinking, oh, I can't have metal from the chest up, that's not always the case. So if you are interested, it would be great if you reached out and we could toy that out with you. That way you're not kind of telling yourself, oh, I'm not a candidate.
Yeah. So basically what you're saying is, really it's an individual sitting down, going through everything, and then you can decipher from that if they have to be disqualified.
Absolutely.
From that standpoint. Yeah. So is TMS a new treatment for patients struggling with depression?
TMS is not new. I know it sounds new and flashy, but the FDA actually approved this in 2008, and it's recently become more popular because it is so effective with patients. And there really is a lack of systemic side effects. So patients are more apt to try something that they know they're not going to have side effects of, and it's effective.
And it may seem new because it hasn't been in Vermont before our program here at NCSS. So we started the program just before COVID. And COVID did take a hit to our program where we weren't seeing patients for an extended period of time. And we're ramping back up our program as we speak. And again, why we're here today, to get the word out that we do have TMS here in Vermont, right here in St. Albans.
Yeah, and that's great. And as you said, you don't have to be a current client of NCSS by any means, and can be from virtually anywhere to receive the services. And it sounds, at least from things that I have read, that it can be so successful for people that have just tried every other possible alternative, and they haven't found the answer.
And those are the patients that we're seeing. We're seeing the patients that have literally tried everything, and they're looking for, what can I try next? Because the medications aren't working for them.
Yeah, most patients have a 50 to 70% reduction in their depression following a TMS session.
Which is significant. And I can't even imagine. I mean, as you said earlier, Miranda, there are individuals that have lived virtually maybe their whole life struggling with this and trying to make it through day in and day out. Must be extremely difficult when, experiencing that.
Yeah, I mean, it becomes a day-to-day for them. And that's why kind of when they get to the point that they want TMS, it's their ability to really function the way they want to is affected. So it puts a higher level of want or need for improvement in symptoms. The patient's more acute at this point when they want this treatment. And it's super effective. Like April said, 50 to 70% of efficacy in patients. I've had patients that have returned to me. Every 6 months, actually, patients can be reapproved as long as they're still meeting criteria. That's not everybody. TMS is individualized. Like I said, we can't tell somebody when they come in for sure if they are going to completely not have depression anymore. But for the most part, most people do.
Most people have some improvement.
Yes. They're not completely out of the woods, should I say. Sure.
But because they've been struggling with such a severe situation, I'm sure they feel that 50, 70%, if that's the change, that's immense.
Absolutely.
In someone. So I was going to ask, how effective is TMS? I know we're talking about some percents and that sort of thing. Are there any other ways to kind of exhibit how effective this therapy can be?
So we talked about those patients who do have improvement. It's 50 to 70% reduction in their symptoms, depression symptoms, but about 80% of people do respond well to the TMS. There are some people that that don't, but a very large majority of people do respond well to TMS.
I would say out of all the patients that I've treated since I've been doing this, and I've been doing TMS for a little over 2 years now, I have seen probably more than 80%, honestly, have some efficacy. It's very, very far and few between where a patient either is not tolerating and dropping out, which I think I've had one patient, honestly. And very few have felt that they did not get anything out of treatment. So even that in itself really shows how beneficial this programming is.
Mm-hmm. And from a medication front, can patients stop taking their medications?
So again, like everything else in medical land, it's very individualized. So TMS typically is a supplemental treatment with combination of psychotherapy and antidepressants. We ask that when patients do come into treatment, that they don't change their medications. We don't want to mitigate any potential that we are getting from the treatment. Patients after treatment, some can stop their medication or reduce their medication, but that's not as common. Most patients do stay on some type of medication, and this is always as directed by their treating provider.
Mm-hmm. Now, with all that being said, let's meet the TMS team that we have.
That's me. That's me and April and our covering nursing staff at NCSS.
So we have one NCBM psychiatrist that's here in our St. Albans office every week. So he sees our patients every week, a check-in, and is there during their sessions. And we also do have our own NCSS psychiatry team, where every day that there is TMS happening in the building, there is a member of our psychiatry team available. So that's a big team, but on the screen you'll see that we have Dr. Dino Santoro. He's the medical director of NCBM. And Dr. C, we call him, is our doctor that's in the building once a week. And then both Miranda and I do TMS. However, I just am a covering nurse for Miranda. And we do have a few other nurses that are trained as backup coverage.
And that is one of the things I know a lot of folks, when they think of NCSS, and may not think in terms of the size nursing staff that we have. I'm sure it would be a surprise to them to know that. So Miranda, with everything being said about this program and everything, how can somebody get in contact with you if they'd like to learn more in depth about this program?
Patients can reach out to me at my email listed. Also, they can call me directly. My desk number is 802-393-6456.
Okay, give that number again.
802-393-6456.
That sounds great. And, as we talk about this therapy, and I know that we've been doing it, and unfortunately there was the pandemic that kind of put a little blip in the program. But from the standpoint of all of those that you have served to date, is your sense that, and I know that it's not for everyone, but have you seen some individuals where it's been really astoundingly significant as to how different they're able to deal with their daily lives after having this therapy?
Absolutely. Absolutely. I've had patients that have gone into complete remission. There were no signs and symptoms of depression at the end of their treatment.
And we've had people not only in remission of their depression symptoms, they also are letting us know that they're sleeping better, that their cognition, their memory has improved, they have more energy. We do have people who, within the first few treatments, are reporting those positive things as well as the decrease in their depression symptoms.
We always talk at NCSS about, each individual and stigma and overcoming that and changing lives so that people can make the most of their life. And certainly when you talk about people struggling with severe depressive disorder, that is an area where it's got to be very dark for those individuals. And the other thing that we talk about so often is people that don't seek treatment for many, many years, even though they may be depressed or having a high anxiety or be bipolar. And the longer they wait, of course, the more difficult it is to sometimes get that turned around. But this particular therapy model sounds pretty encouraging for, I think, a lot of people who may feel there is no other alternative, because especially if all the medications they've been taking haven't really been able to make a difference.
We're so glad to be here today to talk about this and let the viewers know that this is an option. And like you said, the people who wait years and years and years before they come in to seek treatment, I hope that they see this and realize that we do offer this program. TMS is available for them, and to call us and see if we can get them in.
And I think the whole thing there is that, we do have available time slots. It's not as if there's a wait list, or if I'm speaking correctly, or am I incorrect in what I'm saying?
We do have a wait list per se, but I have active openings. So based on the wait list, it's more or less, I have had a touch point with the patient and I'm waiting for their intake to come back.
Mm-hmm.
So all of their baseline information that we need to gather to get it improved.
Sure. So
approved.
It's okay.
And sometimes the approval process does take a few weeks. So
Sure.
People should know that it isn't instant. We wouldn't get them in the next week.
Mm-hmm. I think that's important, though, that people don't think it's like, they come in and boom.
Yes.
Right. It is
Yes.
a process to get all the paperwork and get them approved and then get them in for their first visit.
Yes.
Okay. Well, listen, I want to thank both of you for being here today and sharing the information on this TMS program. I want to thank my guests, April Mathieu and Miranda Tatro, for sharing their insights on transcranial magnetic stimulation therapy as an alternative for individuals suffering from severe major depressive disorder. I also want to thank you, the viewer, for spending time with us again this month. You can learn more about NCSS and all of our programs and services by logging on to ncssinc.org. I'm Joe Helko, and I'll be back next month with another episode of NCSS Here for You.